whenever you reach 37 نحكي fertility begins to decrease.
Like especially for a working woman who is busy, who has aspirations, you know, marriage and kids sometimes take a back seat. At the time where you decide you want to start having a family, you want to start looking for a partner, you're like, oh my God, okay, I haven't thought this through.
You know, this topic is very controversial, and it's really controversial in science as well.
Hi guys, this episode is going to be a little bit different than the other ones. It is more of a personal story for me because last year in November, I froze my eggs. And it was a very exciting and kind of nerve-wracking time for me a little bit. I hadn't known what to expect. However, this episode isn't to convince anyone to do anything. It's more of an informative session with my own doctor who had done the procedure on me and taken me through the entire journey. So I'm so excited to introduce you to this episode with my very own doctor, Dr. Suleiman Ghuneim. I hope you love it and enjoy it. Dr. Suleiman, thank you so much for being on the podcast today.
You're welcome. Yes, it's my pleasure.
You are my egg freezing doctor, but I'm sure your credentials go way beyond that. So please introduce yourself to everyone. Tell us exactly what you do.
Thank you so much, Yasmin. Thank you for having me. For everyone who's listening, thank you so much for joining Yasmin and her wonderful podcast. And to targeted audience, especially that we need such awareness in our part of the region.
Yeah.
So, أنا Suleiman Ghuneim. I'm an obstetrician gynecologist or an OBGYN.
Yeah.
I subspecialized in reproductive medicine and infertility. And my areas of interests or areas of research and areas of work mainly بعمان is fertility preservation. Fertility preservation بالعربي هي الحفاظ على الخصوبة, which includes طبعا egg freezing, sperm freezing, embryo freezing, and so on. Amazing. And reproduction in general, and assisted conception, helping people out in getting pregnant and so on. Yeah.
So I was recommended to you by a friend.
Yes.
And I, like many women, had, you know, I had second thoughts. I didn't know if I wanted to freeze my eggs. I didn't know what it entailed. I didn't know exactly what it meant. You know, I thought there was going to be some, you know, maybe perhaps physical pain, mental pain. I didn't know anything actually. And when I came to you, I was a bit nervous, but you immediately put me at ease because you went through the actual history of egg freezing and you gave me a really good kind of thorough explanation of why people are freezing their eggs these days, which I really appreciated because that was like the first step of feeling really comfortable and feeling like, wow, this is something that I'm actually going to do now. And it was exciting.
Thank you.
I'm going to get to the point where I'm going to get you to explain that little procedure of what you do at the beginning because I'm going to walk people through how it would look like if they were a patient, which would kind of inform them a little bit more. Now,
absolutely.
Just before that, I just want to know roughly between the last year or last 2 years until this year, how many more women are now freezing their eggs? Is there like a percentage you can give me?
Freezing has been there since the 1980s. Okay, it has evolved over the years in so many ways. يعني احنا egg freezing, sperm freezing in general has evolved in so many ways that it became extremely successful. Where actually, in our part of the world, we have expertise and we have the experience, and we have the success rates compared to the West. Over the past 3 years, definitely there has been a significant increase in the amount. خليني أحكي لك of inquiries, maybe, and visits to the clinic, and the procedures that we are doing. And over the last maybe a year or 2 years, maybe 50% increase in visits and inquiries. That's probably actually doing the procedure, and people who end up doing the procedure, probably there is an increase, but it was roughly between 20 to 30%.
But what do you mean? Isn't it whoever comes to see you for the egg freezing, don't they eventually do the retrieval or no?
No, it's not necessarily. No, not necessarily. Because this topic is a little bit sensitive, and it needs a lot of counseling, and it needs a lot of thinking. With a single visit, if a patient comes in for a single visit and single consultation, she needs some time for the information to sink in.
Yes.
Is it what I want? Maybe I should take a couple of months maybe to think about it more. يعني, you know, there are a lot of factors that play a role. Maybe I should tell my parents, مثلا. Should I get someone else involved with me? You know?
Say I'm a new patient.
Yes.
What's the first kind of step you would, I'm in your clinic right now and I want to ask you questions about egg freezing. What's the first thing you would tell me?
I usually walk you through the history. Okay. I walk you through the history, how IVF started, controlled ovarian stimulation, how it started, you know, giving you some history and facts, and taking you through significant milestones بالحياة اللي وصلتنا لهون. And then after that, and I will try to explain as much as I can, the simplest way possible, how the female body works, how you work naturally and normally. And how do we alter this this normal physiology?
What's like the most common most common concerns that females come to you when they want to, you know, ask questions about the egg freezing process?
Yeah, the most common questions I get asked is how safe it is.
Okay.
How safe is it? Okay. How safe is egg freezing? يعني أنت عم تحكي you're putting a lot of things at stake. أنت عم تحكي كتير, you're throwing big words. Okay, sometimes.
Exactly.
You're throwing hormones, stimulation, ovary, reproduction, ability to conceive in the future. But if you take them, بقول لك إنه step by step, make them understand, you will eventually recognize إنه these hormones that we are giving, okay, these are natural hormones. Right. These are similar to the hormones that your body releases every month.
Right.
We just give you a higher dose من هذا الموضوع. عرفت علي? So this is a nice way to simplify things إذا بدك, أو relief السترess تبع البيشنت. Okay. بعدين there's obviously the long-term side effects من الهرمونز, short and long-term side effects من الهرمونز. نقول لك okay هرمونز, طيب كيف رح يأثروا علي؟
That's what I was scared of.
إنه رح أكيد أول سؤال هو بقول لك إنه طب رح يزيد وزني مثلا, رح أنصح, رح أتغير, رح يصير معي إشي, رح أزعل. إنه will it affect my day-to-day life? Will it affect the quality of life? Well, actually, this topic is very controversial, and it's really controversial in science as well. And we can see in the literature, there are many studies that showed many people, they tolerate it very well. You've seen for yourself.
I want to get to that part. I want to get to the hormone part, because that part was the most scary for me, because I was like, am I going to change? Am I going to be a different human being? But then I wasn't. I'm still the same.
Exactly. You're still the same. You're receiving hormones, أكيد, injectables. The injection itself is, it's not nice. To inject yourself every day, مثلا once. It's not nice, ما حدا بده يعمل. بس remember, it's for a very short period of time. Number one. Okay. Well, number two, there are no significant side effects. Significant, it doesn't affect the quality of your life.
Right.
You can pursue your work normally, you can go to work normally, you can exercise, you can go out, see your friends.
You feel a little bit more moody, but it's okay.
Yeah, أكيد. There are في side effects, absolutely.
I'm definitely going to kind of tell people my personal experience of it. But before that, I just want to say, for someone who has never done this before and has no clue about it, maybe you can take us through the process. Like, if, for example, the first step that I need to do I need to be prepping anything before I come to you? Do I need to be like, what mental state or physical state do I have to be in order to decide to want to freeze my eggs?
Right. أول شيء, the fact that you came seeking or asking about fertility preservation or asking about egg freezing, something has to be going on in your mind. This is an elective procedure. If we talk about social egg freezing, I will elaborate about that أكتر. If we talk about social egg freezing or freezing your eggs for any social reason, okay, whatever the reason is, okay, so your career, you're focusing on your career, you're focusing on your education, you live abroad, for example. You've been through a relationship that didn't end well. You've been previously married. Okay, something must have happened. Okay, which is significant in your life. شو ما كان. Okay.
100%.
لازم يكون صار إشي عشان for you to seek the option of freezing. Okay. لأنه social egg freezing is elective. إحنا we spread awareness بنقول ونحكي وكذا. But at the end of the day, it is an elective procedure. Elective procedure يعني you choose to do it.
Yeah.
Okay.
Yep.
مش أنا بقول لك you have to do it. It is different from medical fertility preservation. أو اللي
It's
هو
not a necessity.
Exactly. It's not a necessity.
Yeah.
Exactly. إحنا medical fertility preservation أو fertility preservation for medical reasons لأسباب طبية هذا سبب تاني. يعني إحنا to successfully freeze the egg, okay, took يعني tremendous amount of يعني time and effort to science behind it.
Yeah.
Right. So it was designed, it was يعني found to the people who actually needed it. Right. It wasn't easy at all. يعني the idea of freezing.
Yeah.
So بعيد الشر عن الجميع. Patients who had like a medical condition, sure, cancer, autoimmune disease, anything that might require, rough intervention, يعني, such as chemotherapy, radiotherapy, and so on.
Hala, just to give people a step-by-step kind of thing. Hala, and when I first came to you, I had to do an AMH test, right? It was a blood test that basically tests how many eggs or how many many what?
Yes. So the AMH, or anti-Mullerian hormone, it is a hormone released by what we call the antral follicles, أو يعني the follicles that have the potential to develop in your ovary. Okay, so it will give us an idea, only an idea, okay, regarding if we stimulate your ovary, how many eggs could we end up having potentially? Okay, that's the only thing significant about AMH.
Right.
AMH does not predict how old your ovary is. It does not predict the quality of the eggs. Okay. It does not predict when will you reach menopause, for example. Okay.
Right.
It only points out the potential number of eggs that we can aspirate or can collect if we stimulate your ovaries.
Okay.
That's it.
Can someone have too low of an AMH level in order to freeze their eggs?
Too low.
Is there like
what is too low? There is an AMH is a number. Okay. There's no normal and there is no abnormal. في lows وفي highs. Okay. So each person or each woman or each woman's ovaries are represented by a certain AMH.
Okay.
يعني مثلا an AMH of 1 will give me مثلا 8 or 7, 8, 9 oocytes. An AMH of 2 probably 15. AMH of 20 of 2.5 probably 20. An AMH of
Okay.
يعني
so if someone had a low AMH, they should not worry whether they can freeze their eggs or not.
لا.
It shouldn't be a worry.
لا. It shouldn't be a worry. بالعكس. هلا نحن if your AMH is low, okay, it means that if we stimulate your ovaries, you're going to give us a lower number of eggs.
Okay.
That's
right.
it.
That's it. Okay.
بس هلا thinking about it, okay, thinking about many people are concerned if I have a low AMH, okay, and I'm reaching to an age where my fertility is being compromised, for example, and I have a low AMH already, probably I need to start and hurry up. بموضوع freezing. Probably يعني.
Yes. So I have a question. What do you think is an age? I know this is going to be you're going to give me like it's going to be a controversial maybe thing, but like, what's the age, the oldest age a woman can freeze her eggs?
Freeze her eggs. Well, there is no age limit. Okay. أكيد. يعني إذا أنا بحط age limit أنا مين أنا يعني أحط age limit؟ بالعكس إحنا في عنا علم، في عنا literature، في عنا science behind that. نحن we know that if you freeze مثلا a chance of an egg إنها تجيب baby، إنها تصير baby if fertilized with a normal sperm later on in life, okay, at the age of 30 for example, has a much higher chance of developing into a baby أحسن من one egg at the age of 40 مثلا. فهمت كيف؟
Right.
So نحن we have a table. okay, or we have graph, or whatever you want to call it. So احنا for example at the age of 35, in order for us إنه هيك بالضبط الستدي that was conducted, in order for us to ما نكونش بإيدين الله وهيك، بس يعني الله اللي أعطانا العلم نفس الوقت عشان نحكي لك إياه. بس نحن بنقول مثلا if you desire one baby at the age of 35 هلا you need to freeze مثلا 10 eggs. فهمتي علي؟ So in order for us نكون مرتاحين و at least مبسوطين إنه yes, probably our chance of having at least one baby is high. The probability will decrease as we grow older.
Right.
So to counsel a patient who is above 40, for example, okay, about egg freezing, I will tell her probably, and in order for us لنكون مرتاحين كتير and give you good statistics and a good percentage of having at least one baby, you're gonna probably need 25 eggs. Okay. طب احنا we know for a fact that a patient above the age of 40, okay, أول شيء the egg quality is compromised, by number one, وتاني شيء the number or the reserve is compromised.
Okay.
So it is very difficult for her to achieve what we're trying to.
So at what age does the egg count or quality become compromised? Is there an age?
Yeah, there is a rough estimate. يعني احنا بنحكي whenever you reach 37, okay, and if you are approaching 37 and above, بنحكي fertility begins to decrease. طبعا it decreases with time. يعني مثلا ال 20s غير عن ال 30s.
Yeah, of course.
بس يعني الدروب الكبير بيصير يمكن بعد ال 37 38.
Okay, so I got it at the right time then. Thank God.
So then, and I always tell patients, and if you freeze your eggs, you always win. عرفتي كيف؟ You have nothing to lose. يعني you always win.
في كثير ناس صاروا هلا إنه even in their early 20s they want to start freezing just in case.
Absolutely.
Do you recommend that?
Listen, أنا بقول إنه مش I recommend. At the end of the day, it is an elective procedure.
Right.
It depends where do you see yourself.
Okay.
Into you judge. I can't judge عنك, you know.
Yeah.
My job is to be there for you, or you know, maestro the whole scenario. يعني.
Right.
مظبوط. For you to be safe, or for you to undergo a healthy, يعني safe procedure.
Right.
تمام. But I cannot make decisions for you.
Exactly.
Okay. My only job is to counsel. To counsel, tell you facts, numbers,
right,
and so on and so forth.
Okay.
Put you on track, which will help you make the decision. Okay. So أنا إذا recommend or I do not recommend these are كتير يعني كلمات يعني بوم. عرفتي؟ مش أبيض أسود يعني.
Okay.
No. بالعكس كل case you have to treat every case individually. Exactly.
Perfect.
ما في حدا زي الثاني.
Great. So now we have done the AMH blood test.
Yes.
We're good. We're good to go. Good AMH. What's the second thing that someone should be doing?
We do a baseline ultrasound. A baseline ultrasound basically gives us an idea about to take a look at your ovaries. They're healthy. Does the number correspond or correlate? يعني ال AMH, does it correlate with what I'm seeing on ultrasound? This is very, very important because sometimes AMH can be misleading. يعني. Sometimes what you see, we don't treat numbers. We treat what we see. يعني. We treat patients.
Yeah.
So we have to do a baseline ultrasound.
Okay.
Check if everything is okay and that we're good to go.
Right.
بعدين we counsel about the next step. Or we explain the next step, which is what we call controlled ovarian stimulation.
Okay.
أو the injections.
أو
الهرمونز. نعم الهرمونات.
Yeah.
There are different protocols to stimulate the ovary. Each individual يعني تختلف عن الثاني. Okay. لا يوجد بروتوكول ينطبق على الجميع.
Really?
Yes.
I actually didn't know that.
Yeah. احنا في ناس بنستخدم معهم mild stimulation, في ناس بنستخدم معهم long, في ناس short, في ناس random start, في ناس يعني كتير في protocols.
I love that.
Okay. That's why we are subspecialized in بهذا الفيلد. Okay. يعني مش إنه one size fits all. No. يعني we tighter your dosage, we tighter your protocol. the plan يعني اللي بنرسمها أنا وياكي مع بعض تختلف من ياسمين لفرح and so on and so forth.
Yes.
عرفتي علي؟ So we start by explaining هذول وكيف بيشتغلوا. How do you inject yourself مثلا getting assistance to where do you inject وهالقصص هاي. And this service is widely available in Jordan. يعني it's available in my clinic, it's available at the hospital, it's available at the lab where I work.
Yeah. And by service you mean like someone to tell you exactly how to you know, inject yourself.
How to take the injections or inject you on daily basis.
Yes.
So basically it's a single injection per day.
So basically you can do it yourself or you can go to a nurse who can help you with that.
أكيد.
Okay, great.
But this is easy and widely available in Jordan.
And how long is this hormone injection?
Well, it depends. It depends, but it's usually يعني from 8 to 11 days. Let's say 8 to 11 days.
Yeah.
On average, 9 days, 10 days.
Personally, I had a great experience with it because I remember I asked you, am I going to be depressed? Like, am I going to be so hormonal or I'm going to get in a fight with everyone?
One of the most common side effects اللي هو what we call mood swings.
Yeah.
بس أنا دائما بقول للناس إنه mood swings مش معناته south.
No.
يعني مش إنه المود لازم يروح لتحت يعني.
So what you had said to me was you make of it what you will.
Exactly.
Which was a really, really good piece of advice because I remember looking at myself in the mirror while I was doing the hormones and I said, you know what, this is a privilege. And I had elected to do this. And I was so happy that I had been doing this. So I felt like while I was doing the hormones, I was like, it's a little bit uncomfortable because you start feeling heavier towards the like later days. Yeah.
Absolutely. Bravo عليك. Yes.
But at the beginning, I was like,
you become heavier, I become happier. Yeah. Because I know, because I know that the medication is working.
It's working.
عرفتي كيف.
Yeah. I was like happy to do it for myself and everything. It was a bit scary at the beginning, but then خلاص, you get used to it and you start kind of like embracing the procedure.
Absolutely.
Yeah.
Because you're so proud. أنا دائما بقول you women inspire a lot. يعني أنا مثلا هلا أنا I'm so happy and so proud that I'm sitting here with you, a person who يعني did egg freezing, you know every single detail ومشينا مع بعض بالطريق كلياتها. It was very successful. الحمد لله يعني كل شيء مرق كتير منيح and you know exactly how we do it يعني. And you decided to share your experience with the world, to share your experience with your audience. This is amazing. You should be so proud of yourself. فأنا دائما هذا اللي بقوله إنه هلا if you look مثلا you did the procedure how many months ago?
It was in November 2022.
It was in November 2022, so 8 months ago. So I'm looking 8 months يعني back هلا. How do you feel?
I feel
you feel so proud.
I'm comfortable. Let me explain to you how I feel. I feel that I'm somehow insured in a way. I feel comfortable. I feel like in the back of my mind, I am in a way like I've backed myself up.
Absolutely.
You know, because these things like you don't know some things in life, like especially for a working woman who is busy, who has aspirations, you know, marriage and kids sometimes take a back seat. And at the time where you decide you want to start having a family, you want to start looking for a partner to have a family, you're like, oh my God, okay, I haven't thought this through, but thank God I thought it through and I was happy. And it did take a while. Like a lot of girls, the reason why I'm doing this podcast anyways, because a lot of girls are on the fence. And you know, affordability and all that kind of stuff does come into play, of course.
Absolutely.
But yani, taking it seriously, I think that it's just like someone needs to push you a little bit. It's just like, okay, go ahead, you can do it. And
yes.
Yeah, I think that's.
Congratulations, عشان هيك يعني.
Thank you. Thank you. Perfect. Okay, so say someone's taking the hormones and everything. When it comes down to time to retrieve the eggs, and you've done, because I know at the end of the hormones, there's something called a trigger shot.
Yes.
You wait 36 hours.
Absolutely.
And then you arrive to the clinic to get your egg retrieval.
Absolutely.
What can people expect on the day of the egg retrieval?
So نحن basically when throughout those, let's say 9 days of stimulation, you undergo a serial ultrasounds, for example, serial monitoring, whether it was with by ultrasound itself or ultrasound and some blood tests. Sometimes نستعين blood tests in order for us to يعني ensure that we are moving in the right direction. So throughout هدول 9 days نحن في stops معينين. Okay, where we pause and reevaluate ourselves.
Right.
And we're moving towards the right direction?
Yeah.
Are we okay? Shall we continue? Shall we change the dosage and so on and so forth? تمام. هلا once we finish هذا الموضوع ببلش يبين معنا when is your egg collection date ببلش يبين معنا so 36 hours or 37 hours يعني before your egg collection نحن we administer what we call the trigger shot. The trigger shot is what triggers the ovulation. Now 36 hours later you will ovulate on your own. So Anna, my job is to go a little bit earlier than 36 hours so that I can retrieve your eggs before you ovulate. Before I lose them.
It's such a sensitive time.
Yes, it's such a sensitive time because the trigger shot works not only by triggering ovulation, it also كمان works at the level of egg maturity. I have to give you the trigger shot in order for the eggs to be mature and final and ready to be released. But then I have to go a little bit earlier than 36, so probably half an hour or an hour earlier. And collect. So answering your question.
Amazing. So now someone's retrieved their eggs. How long is the procedure usually? How long does it take? And is it painful?
هلا خليني شوي أرجع. You asked me كمان شغلة كتير مهمة. إنه what are people's concern? What do they ask you?
Exactly.
They ask me a lot about the procedure itself.
Yes.
حطي موضوع الهرمونز على جنب. Once you established إنه الهرمونز are safe. شو يعني safe? Safe يعني the side effects are short term. Once you stop the hormones, the side effects will fade away. Number one. And there are no long-term side effects من hormones. هذا كمان شيء لازم أحكيه يعني. شو يعني no long-term side effects؟ يعني stimulating your ovaries with these hormones does not increase the chance of cancer. Any type of cancer. هاي number one. So this is a huge relief للناس. ونمبر 2 لأنه بقول لك طيب if you're gonna take out مثلا let's say 20 eggs out of my ovaries will I get مثلا
will I have any left?
Exactly. Will I have any left? So if you explain it properly لا إنه every month نحن في عنا ovulation with one egg. هذه ال one egg تيجي من a pool of eggs. هذا ال pool of eggs هو بيروح ضعان every month. So instead you don't actually lose an egg a month. You lose the pool.
The reserve.
يعني exactly. بس you lose that pool. اللي هي تطلع كل شهر وواحدة منهم matures و ovulates. الباقي they basically die. So بدل ما هم يروحوا دعان ويموتوا حرام يعني. نحن we rescue we salvage هذا this reserve exactly and take them out and aspirate them. So مش معناته إنه راح تقطعني الدورة بكير. هذا كمان كتير مهم.
That's a third concern of people.
Exactly. It's a concern. It's a major concern. راح تقطعني الدورة بكير. أنت أخذت مني 10 eggs هلا. شو يعني ضيعت 10 أشهر من حياتي؟ لا أنا ما ضيعت 10 أشهر من حياتك. هدول ال9 أنا هم one egg you will ovulate فيها. وال9 راح يروحوا ويموتوا. So this is the principle يعني.
Right.
بس هذا بقول لك بترجع بعدين على رواق يعني this is why people has to understand the physiology behind it يعني كمان.
هلا just honestly speaking after someone takes hormones can there be any abnormal side effects that can last for a long term? I've heard something about like a fake pregnancy phenomenon or something like that. Is that like real?
It is real.
What is it?
I really يعني بأول شيء data is really يعني weak. In regards to هذا الموضوع.
Okay.
بس
is it
let's not go there.
But is it common?
It's not at all. Not at all. But there are no long-term side effects من المedications. ما في pseudo pregnancy وهذا القصص.
That's pseudo pregnancy.
Phantom pregnancy. I don't know. This is يعني شوي it is more psychological I guess.
I feel like
it is not exactly. It is not related to the medication. It is more and actually it is on the way of being classified as something psychological. مش إنه physical يعني.
Interesting. Well, it does make sense that the hormones will eventually أصلاً be released from your body. I mean, you're a human. You go,
طبعاً.
you're building different cells every day. You're going to the bathroom. toxins get flushed out. So it makes sense. Okay, so we've talked about the concerns of what people have. Like during the retrieval, can you give us like an idea of the recovery? Like, is it difficult to recover from such an operation?
Yeah. خليني أحكي لك شوي عن the procedure.
Okay.
The procedure is what we call a minimally invasive procedure. Okay. Minimally invasive. And it is not surgical. Okay. ما فيها cuts, فيها scars, ما فيها recovery time is extremely fast. يعني عم نحكي عن 24 hours, 48 hours maximum. Okay. الواحد برجع لحياته. Some people actually they do the procedure in the morning and they travel in the evening. مثلا بدبي بالإمارات.
Yeah, which is what I did actually. Yeah. 48 hours later I was back in
يعني 48 hours actually في ناس on the same day.
Yeah.
ففي ناس بيجوا من بيروت بيعمل procedure and they leave. Okay. So it is safe. It is quick. The complication rate is extremely rare.
Yeah.
Okay. لأنه it's minimally invasive. Okay. ولما نحكي minimally invasive شو يعني؟ يعني it doesn't involve the great deal of surgery.
Right.
يعني it's not a surgical procedure. عرفتي؟ It's an ultrasound guided procedure. Okay. So again هذا الموضوع very very sensitive. Okay. موضوع the procedure itself. How do you do the procedure? Okay, it depends whether you're sexually active, whether you're not sexually active, whether there are different ways. Okay. لأنه في كمان يعني some social concerns regarding هذا الموضوع. Which I speak about كتير بوضوح وكتير برواق وكتير بتروي وكتير بوقت مع البيشنتس بالكلينيك. لأنه في different ways to do the procedure. كلياتهم under the term minimally invasive procedure. وكلياتهم they have the same recovery time والقصص هاي.
Wow. So definitely whoever wants to do this process, يعني they have to have a conversation at length with you.
Absolutely.
Or with the doctor.
with a specialist يعني.
Yeah.
And يعني it's preferable that they have this conversation with a reproductive medicine specialist. مش a regular obstetrician gynecologist. يعني with all respect to all OBGYNs.
Yeah.
بس في ناس يعني they are subspecialized بهذا الموضوع.
Exactly.
عرفتي كيف؟ زي ما في subspecialty بالoncology for example أو بالpregnancy أو بالobstetrics أو different areas. في ناس they specialize in fertility.
Yeah.
في ناس they specialize بهذا الموضوع. So in order for you to get the most recent valid scientific information, speak to your reproductive medicine specialist.
Okay.
هيك.
Great advice. This is good. Perfect. عشان so you know you don't come back to us in the comments and be like no actually this is not so like
لا أنا لأنه بحكي هيك كمان إحنا بقول لك إحنا the lack of regulation بالأردن
because it's new-ish يعني
the lack of regulation بالأردن على كل شيء. Okay,
so say someone's gone through the retrieval process and now the eggs are frozen. Where are they kept and how long are they stored and how long can they last?
Yeah. Theoretically, خلاص we did the egg freezing.
Yeah.
تمام.
Eggs are frozen.
Like يعني let's say 40 hours after a trigger shot. يعني let's say like 4 hours after retrieval, more or less. Okay, and then we analyze the eggs. Okay, we look at them under the microscope. They have to fit a certain criteria.
Right.
We have to assess their maturity. We have to assess their quality. We have to assess. And they have to pass certain. They have to check out on certain things.
Yeah.
Once you deem that this egg or this oocyte is mature and has the potential capability of fertilizing and later on in life and producing a baby, then you freeze it. Okay. The process of freezing is usually very, very quick.
So sorry, just to explain to people that basically after the retrieval process, the amount of eggs that you retrieve is not necessarily the amount of eggs that you freeze.
Absolutely.
Yeah.
Yes. This is very important.
Yeah. So say you get 10 eggs.
10 eggs, probably we'd say like 70 to 80% of them, they meet the criteria if the patient has been prepared properly.
Yeah. Right.
Okay. If the patient has been prepared properly, 70 to 80% of these, roughly, will pass. Okay. And we will end up freezing them. Let's say we ended up with 8 oocytes.
Yeah.
Okay. I divide them into trials.
Okay.
Or into straws. Okay, I freeze each 4 لحال مثلا. So مثلا I split them into 4s, I split them into 5s, I split them into 3s. It depends.
To give them more of a chance of
To give them more of a chance. For
Right.
example, if يعني, let's say Yasmin in the future she came مثلا seeking her eggs.
Yeah.
Okay, I will give her مثلا if you froze like let's say 10, I will give you 5. مثلا I won't give you the 10.
Oh really?
عرفت كيف؟
Interesting.
So and I will keep 5.
Okay, and those...
بالstorage so that I can give you
and the 5
أكتر chance إنك تستخدميهم يعني.
But the 5 that you have.
Yeah.
Okay. Say I come to you in the future. I'm like, hello, I want my eggs. And what happens when those eggs come out of the freezer? Are they defrosted?
Yeah. So هلا نحن the process of freezing خلينا نحكي. We retrieve the eggs. We deem that they are mature. It's time for freezing. We freeze them in liquid nitrogen.
Okay.
Under minus 200 degrees Celsius. The process is very fast. Scientifically, it's called vitrification أو rapid freezing. Okay, زمان كنا نقول slow freezing. But slow freezing is detrimental للeggs. يعني it damages the eggs.
Right.
هلا نحن we use vitrification or rapid freezing to increase the survival rate of eggs. يعني نحن هلا the success rate of egg freezing, مش success rate of pregnancy, the success rate of egg freezing has reached أكثر من 95%. حتى بدي أقول لك أكثر من 98%.
Amazing.
عنا حتى بعمان.
That's such a cool thing.
So the survival rate of eggs بالفريزر is almost 98-99%. بعدين بنحكي إنه and they are stored in tanks. طبعا هدول التانكس they are filled with liquid nitrogen under minus 200 degrees Celsius. they are labeled. هذا الحكي بنحكي فيه بعدين. patient identification هذا it's something else. يعني we've never had الحمد لله يعني.
You've never had any mix-ups?
Yes, exactly. The lab where I work يعني handled over the past let's say 35 years or 36, 37 years. And since 1985 85.
So
يعني handled roughly around 100,000 cases بين IVF freezing. Never ما عمره صار أي خربشة يعني. So patient identification, labeling and so on, patient confidentiality والقصص هاي is extremely important. يعني there are 10 identifiers probably بالمستشفى. And all of them have to match. Okay. وإلا you won't get access to your eggs.
That's very comforting,
And then بعدين لما نعمل defrosting للإيجز بصير في عنا الإيجز. 5 eggs مثلا أو 4 أو 3 أو whatever النمبر اللي عنا.
Right.
They are defrosted and they are ready to be injected.
So the egg itself is re-injected back into the woman's body?
No.
Okay.
The egg as an egg is a cell.
Is a cell.
Yeah. يعني أنت eventually you will use it. Why? لتجيبي baby.
Right.
مش هيك? So you have to fertilize it with a sperm.
So you fertilize it first.
We fertilize it first.
In the lab.
In the lab. And this هذا اللي بنسميه IVF. In vitro fertilization. الإخصاب خارج الجسم. Okay. So we get the egg, we get the sperm.
Yeah.
And we inject the sperm into the egg.
Okay.
بيصير في عنا إيش؟ Embryo. اللي هو baby يعني. Potential baby. This embryo is re-implanted again. In the woman's womb.
Okay.
You understand?
I thought differently, but this is good.
So if you want to defreeze or to thaw, like a scientific term, to thaw your eggs, okay, these have to be for the purpose of injection.
Yeah, right.
Of يعني fertilization.
Yeah.
صح ولا لا؟
صح.
هلا القانون بالأردن وفي العالم العربي يعني بشكل عام to generalize بس هيك شوي. The law states that you cannot inject or fertilize. You cannot fertilize an egg with a sperm if you don't have a valid marriage certificate.
Right. Yeah, I've heard that too.
بدك عقد زواج معترف فيه بالدولة. أوكي عشان نقدر نحقن البويضة.
Okay.
بالحيوان المنوي.
Interesting. So you can't even basically, you can't retrieve, thaw them before you are married.
Yes. بعمان.
And in Dubai, because
And in Dubai.
That's what I've heard.
Exactly. And in Dubai أكيد. بس however خلينا نحكي هيك يعني بشكل عام يعني. Okay. I hope people don't misunderstand us يعني. بس we have to say يعني أنا بقول لك إنه your eggs are your eggs.
Yeah.
يعني you're free to do whatever you want فيهم.
Yeah.
You're free to discard them. You're free to fertilize them. طبعا legally يعني.
Yes.
You're free to ship them. Okay, for example, Yasmin lives in Dubai, but she has her eggs in Amman.
Very good point.
Yeah. تقول لي Suleiman, I need my eggs.
Yeah.
I recently got مثلا married بدبي وأنا كذا كذا. I thought of using my eggs for some reason or for one reason or another.
Yeah.
بقول لك okay, great. تفضل ياسمين. أنا I will get in touch with a certain lab مثلا موجود بالإمارات. Okay. We'll do the legal work and then we can get your eggs shipped من عمان للإمارات.
That's so great.
And we did that.
And you've done that before.
Yes, because the cost of fertility preservation in general بالأردن يعني in general in Jordan is much cheaper than الإمارات.
Yeah,
than Europe, than UK, US, Canada. طبعا احنا we shipped to Spain, we shipped to Hungary, we shipped to مرة بكندا. بس عملت أنا يعني مش إنه.
Do you get a lot of people from outside coming?
Yeah, absolutely.
So okay, you mentioned something about the cost and why people come here and do the retrieval, well, the process here. Can you give us a little bit of insight about the affordability? Yeah. Or a range? You just give us a range of how much.
A range. هلا أول شيء it is stratified أو it is divided يعني. The cost is divided على أكثر من شيء. There's the cost of medication. في عندك the cost of hospital اللي هو the pick up وفي عندك the cost of freezing وفي عندك يعني any extra costs that might يعني that might come up يعني بالموجود بس in general يعني it is the medication and the freezing process with the hospital. Yeah.
Sorry to interrupt, but can I tell you I had an extra because once I had an injection and it fell and my medicine fell on the floor because I did a mistake and I had to buy extra medication. So that's something that could happen.
That could happen and it's not it's not cheap. يعني buying an extra set of مثلا يعني a day's supply of medicine يعني is not cheap.
Yeah.
صح ولا لا؟ بس roughly it's in the range يعني I can easily say إنه it's in the range of probably من $2,000-$4,000.
Okay.
يعني.
Between 2 to 3, 4. 2 to 4. Let's say 2 to 4.
Let's say يعني maybe.
Okay. Depending on how many maybe.
Depending on how many injections. Depending on how many eggs. The more eggs you have, the more
you need to freeze.
The more you're going to pay because you're gonna use hospital equipment. You're gonna use more straws. You're gonna occupy more freezing space. عندنا في المستشفى. So this costs extra يعني.
Okay, that's a good point.
Yeah.
Some people say they don't know if they should do a 1 round or 2 rounds.
That depends.
Okay, that depends.
هذا depends on the counseling أكيد.
Okay.
يعني I have patients that freeze their eggs every month.
What?
Yeah.
Really?
Because you mentioned مثلا a low AMH. And she's approaching مثلا a certain age. Okay. Where egg quality is compromised. So I tell her مثلا the natural cycle instead of ما هي لو مثلا if we give her injections or stimulation or if we don't we're gonna get the same result. Okay. So on a natural cycle come in and freeze it. هاي الأج بدل ما تروح ضعان ovulation.
So you can freeze them without the stimulation?
Absolutely. بس هذا in certain cases.
But this is different.
بس in certain cases.
Okay, interesting.
You asked me about for how long do they stay frozen?
Yeah.
يعني نحن theoretically there's a theoretical وفي practical. In theory you can freeze them forever.
Okay.
In theory لأنه they're frozen. صح ولا لا؟ يعني they're frozen. شو الفرق بين سنة وسنتين وثلاثة وأربعة وخمسة وعشرة؟
Right.
صح. بس in practice we have evidence ل 25 years.
Okay.
Yeah.
25 years.
Yeah, we have evidence ل 25 years. And we have evidence of eggs surviving and producing embryos من 25 سنة لهلا.
Okay. The same frozen egg.
Yeah.
Actually, I have a question.
يعني إذا أكتر يعني if I'm not mistaken, I think it is more.
I was really curious about something that, for example, someone is beyond, say 43. She decided to get her eggs and have a baby. Now, is there a change that happens in a woman's body after, a certain age where she may not be able to carry the embryo?
Mm-hmm.
There is?
It's a very good question. Okay. هلا it is thought علميا خلينا نحكي scientifically يعني علميا the uterus or the womb the carrier of the baby all right is usually independent من الامbryo. Okay.
Okay.
So if you have a good embryo and you transfer that embryo back into a well-prepared uterus, no matter how old the uterus is, the incubator, okay, هذا scientifically عم نحكي احنا, in theory, okay, your success rate remains the same. يعني,
okay.
For example, Yasmin is 32. She froze at the age of 32. Okay. We defrosted her embryos at 43.
Okay.
Her eggs at 43. We injected them, became embryos. The embryo's age is 32. احنا لأنه we froze time, صح?
Right.
Okay. Now 11 years later, هلا you're 43. If we prepare your endometrium or if we prepare your uterus بشكل صحيح, okay, you will have the same chance of getting pregnant بهذا الوقت نفسه at the age of 32 اللي هو the age of the embryo.
Wow, that's
yes, هذا scientifically speaking.
Okay.
Yeah.
So amazing. Hala, there's just one thing that I wanted to know, maybe before you're even thinking about freezing your eggs. Should someone be living a certain lifestyle? Is there certain foods they should be eating? Is there certain things they should not be doing, like smoking, drinking, etc.? Can you give us like just three things and to optimize your chances?
Well, to optimize your chances, أول شيء نحن دائما بنحكي أي شيء منيح لنا بالحياة منيح للفرتيليتي. Okay. يعني إذا smoking بيأذينا, okay, فsmoking بيأذي الفرتيليتي.
Right.
إذا الدرينكينج heavy drinking بيأذينا مثلا, فهو بيأذي الفرتيليتي. إذا مثلا being overweight or obese is harmful for us, definitely it will harm our chances.
Yeah.
يعني نحن بنحكي بنقول إنه أي إشي مفيد لنا هو مفيد للفرتيليتي.
Okay, perfect. هو people have different يعني ideas about that.
ما في إشي بيقول إنه والله بدي أعمل هيك عشان أحسن الفرتيليتي. There has been links between poor mental status أو stressed mental status أو يعني depression, anxiety, stress, whatever.
Yeah.
Okay. It has been linked to poor fertility. Poor outcome, poor fertility outcome, خلينا نحكي.
Interesting. So make sure
يعني ودائما بنقول يعني one of my teachers, she's one of my mentors actually, and I really يعني هذه الكلمة بتضلها ببالي طول الوقت, يعني طول الوقت. بقول لك الراحة هي الراحة النفسية أهم من إنها تكون راحة جسدية.
Wow.
عرفت كيف؟
Because it affects everything.
يعني it affects everything.
Are there any new findings about fertility, egg freezing, anything that you can tell us that could be, exciting for the fertility industry?
Absolutely. نحن there's a lot of work هلا in the field of ovarian rejuvenation بنحكي. Okay. كيف يعني مثلا نحكي rejuvenation لأي شيء تاني. كلا في مواضيع بالovarian rejuvenation مثلا injecting ovaries with PRP مثلا platelet rich plasma, injecting the ovaries with stem cells, promoting ovarian reserve, especially in patients who have a poor ovarian reserve or premature ovarian failure. There's a lot of research going on in that field in particular يعني.
Right.
So هاي إشي كتير مهم. In the area of freezing يعني people are really working هلا towards not only egg freezing but the ability to freeze ovarian tissue. هذا لساته كله it's under يعني.
What's the difference between freezing ovarian tissue and ovarian?
يعني having more of بدل ما نحكي egg نحكي the whole tissue يعني إنه يتجمد. عرفت كيف? Which gives us more chances later on. بس however it's been a bumpy road يعني, وهذا الحكي صار له موجود بس it's seeing light هلا أكتر يعني. It's becoming more promising. It's still not available in Jordan. Yeah, it's not available in the Middle East. It's still under experimentation بكتير بلاد بالعالم كمان. It's not هذا بس there is يعني there will be I think in the coming 10 years يعني we will hear a lot of new things in regards in terms of freezing, in terms of ovarian rejuvenation, in terms of ovarian tissue freezing, in terms of stem cells. بهذا المجال كتير يعني عم نلاقي فيه بيكون فيه فوكس أكتر يعني. وإن شاء الله يعني نحن will stay up to date as much as possible. We'll provide you with the latest always.
Update us on what's happening.
Yeah, absolutely.
Great. Thank you so much,
Absolutely.
Dr. Suleiman. Where can people find you online?
They can simply Google my name.
Do you have a page on Instagram or anything?
Yes, I have a page on Instagram. I have a page on LinkedIn, Facebook, social media in general.
What's your handle on Instagram?
It's Dr. Suleiman Ghuneim.
Okay.
And I will spell my name probably
Yeah.
بعطيك الspelling الصح.
Perfect. We'll put it in the comments.
Suleiman Ghuneim. Or you can just Google my name and send me a message anytime.
You can stalk him online.
Absolutely. Anytime. You can email me, whatever. I'm always open for any questions. بالعكس.
Perfect.
With extreme pleasure.
Thank you so
بالعكس.
much.
Thank you so much.
This has been a thrilling conversation.
Absolutely. والله كثير. It was عن جد. Thank you so much for being such an idol. لكثير من الناس. You're a role model. Many people will look up to you. Not بدي أقول لك إحنا عملنا كثير freezing بحياتنا بس مش كثير في ناس they came out and spoke about it.
Okay.
عن جد.
I hope
you are من الناس اللي كثير قلال and you will change so many people's lives to the better.
Wow.
وأنا I'm so proud of you. Congratulations. بالعكس أنا I should thank you for having me.
Thank you. Great words to end by. Hi. Amazing. So, guys, if you like this video, do like, share, and subscribe. And if you have any comments, just put them in the space below in the comments. And we'll see you on the next one.